In 2007, the American Diabetes Association estimated that there were over 24 million individuals in the U.S. who had either type 1 or type 2 diabetes. They estimated that there would be an increase of over 1 million new diabetics each and every year. The national health care cost of diabetes exceeds $174 billion each and every year, and this is obviously going to be going up. In fact, $1 in every $10 spent on health care is spent on diabetic patients. Most of the excessive cost of treating diabetes is because of the terrible complications that patients with diabetes must suffer. Diabetes is the leading cause of amputations, of kidney failure, and one of the leading causes of blindness and nerve damage. The Center for Disease Control now estimates that 1/3 of the children born after the year 2000 will develop diabetes sometime in their lifetime. In fact, if they happen to be Black or Hispanic, this number will jump to nearly 50%. When you consider the impact that diabetes will have on the overall healthcare costs throughout the world, it simply becomes overwhelming, especially when you consider the complications these people suffer because of their diabetes and the loss of productivity. Modern medicine only has so many answers. In fact, in spite of all the advances in medical and surgical treatments for our diabetic patients, 80% of our diabetics still die prematurely from a cardiovascular event, like a heart attack or stroke. Now, this was true in 1970, and it is still true today. The main reason is the fact that by the time we as a physician diagnose a patient as having diabetes in our office, 60% already have major hardening of the arteries. This is because most of these patients have been struggling with prediabetes for over 10 to 15 years before they are diagnosed with diabetes. And during this time, their arteries are actually aging much faster than they should. This is why the American Association and College of Endocrinology, those diabetes specialists, are now recommending that physicians treat prediabetes as aggressively as they do diabetes, since by the time these patients actually develop diabetes is just too late.